So welcome to week 2 or modular 2. Here we're going to get a little tested with what we think it should be versus what it is when it comes to rendering a diagnosis. There is a case presented this week, Joe, who presents with some real psychotic symptoms, and we render a diagnosis. But as we get to know him a little bit from the case, we see that there has been much oppression in his life that may have contributed to how he presents today. And so therefore we probably have some thoughts about not rendering the diagnosis that is presented for him. So this is what I want you to keep in mind, is that as we assess and we write up our assessment, we are including all of the stressors that enter into this man's world that may or may not render him with the presenting symptoms. The DSM-5 and all the DSMs are based on pathology. We are looking at this from a more holistic view of the world that the person walks through every day and how it contributes to the DSM diagnosis. Okay. As we write up our assessment, which is done at the end of all our data information and collection, we get to talk about all the stressors in this person's world. And then we enter the diagnosis. Major depressive disorder, recent, recurrent, whatever it may be. Okay, but that assessment that you write, between the information you collect and before you write the DSM diagnosis and the categories, the coding, is most important here. The other thing I want you to keep in mind is as you work on your full biopsychosocial assessment paper for based on a movie character, is the mental status evaluation. This week you're working on that. You're not submitting it anywhere, but you are working on that. And I've put some resources in the course for you to take a look at. I want you to keep in mind that the mental status evaluation is only a snapshot of how you see the person in front of you at that moment. It's not about the history, because there's other places in the biopsychosocial document for that to be captured. It is about what you see, what you sense, what you hear, what you see, maybe what you smell, how you are taking in that person at that period of time. So it has to do with mood, it has to do with speech, it has to do with eye contact, it has to do with how one is dressed, it has to do with their gait, their frequency of speech, their memories, all of this. So take a look at the resources that I put in the course for you. If you have any questions about it, contact the instructor or send me an email and we'll discuss it a little further. Have a good week.